I've had a few people ask since Nolan's been done active treatment, like, how do you feel now that your son is all done with cancer? So exciting. He's finished with cancer. His journey with cancer is over. And I'm like not saying anything negative about that at all. Like, I so appreciate everyone's support and anyone who's reached out to us and supported us through all this. Like, we're so fortunate. But because like I've kind of always tried to use this channel as like an educational thing, I just wanted to say, like, you're never really done with cancer. I think with any cancer, but especially with childhood cancer. He's done active treatment, but he's never going to be done with cancer, at least not for a long time. And what I mean by that is because these children are so young when they're diagnosed, they have such long-term effects from the treatments and the chemotherapies that save their lives. And in Nolan's case, because he was diagnosed at a later stage, he already had metastases to his lungs at diagnosis, he has to be monitored really closely for at least 2 years. So I don't have my exact follow-up plan with Onco yet. I meet with them next month to discuss what Nolan's follow-up will look like. But either way, it'll be monitoring either via lab work or scans every 3 months for 1 year. You can hear him playing. And then after that, it'll go to every 6 months, I think. And beyond that, I'm not sure. And that's just monitoring for the cancer coming back, like in case there was a recurrence. But he also has hearing loss, which will likely get progressively worse. So he's going to be followed by a hearing clinic for many years, and he will probably end up with a hearing aid. His heart is something we have to monitor because doxorubicin, which is at the crux of the chemo for hepatoblastoma and many other cancers, childhood cancers and adult cancers, can cause long-term heart problems. So he will be monitored closely for that in the coming years. And finally, like, there's other long-term issues as well. One of the ones I haven't talked about on here, because frankly it's hard for me to talk about. If anyone kind of knows my story more personally, I had a really hard time getting pregnant with Nolan. I had a couple of miscarriages. I actually had a scare with him where I thought I was miscarrying him, and I ended up in the hospital when he was around 11 weeks or so. Anyways, so fertility struggles are near to my heart, and it causes me a bit of distress. But one of the things, we had to make a split-second decision on Nolan's treatment because time wasn't on our side. Like, he needed to start chemo yesterday at the time of diagnosis. So basically, like, long term, we weren't able to do anything to preserve fertility for him. So he probably will not be able to have children of his own, or maybe by that time he will, but it might be a hard journey for him, a bit of a struggle. Yeah, and that's like a personal thing. But at the end of the day, my point is that you're never really done with cancer, especially as children. Their bodies are so fragile. They're resilient, but they're fragile. So while the chemo that he had is life-saving, and I'm 100% an advocate for anyone with cancer getting science-based treatment, he will suffer the consequences for that in many ways for the rest of his life. And it's something that we will have to monitor forever as well. I mean, in addition to that, he also had his gallbladder out with his liver resection. That's another story. So yeah, his journey's not over. Our journey's not really over. It's just active treatment is over and things are changing.